Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of ENT is the esophageal motility disorders and neoplasm of the esophagus. This topic we will discuss in 5 different parts or sections. In the first section, we will talk about the esophageal spasm and the common disorders of esophageal spasm, which we will discuss, will be hypermotility disorders and hypomotility disorders. Hyper will be increased movement or peristalsis in the esophagus, and hypomotility will be decreased mobility of the esophagus. Then we will discuss about the cricopharyngeal spasm, and then diffuse esophageal spasm. So in the first section, mainly the spasm of the cricopharyngeal area, then we will talk about diffuse esophageal spasm, and then hypomotility and hypermotility disorders. Then in the second section, we will talk about the condition known as cardiac achalasia. What is cardiac achalasia? We will talk about that, and then the symptoms of the condition cardiac achalasia and how we diagnose and treat this condition. Then in the third section, we will talk about gastroesophageal reflux, very common condition. Lot of people complain about gastroesophageal reflux disease, and we will talk about what is gastroesophageal reflux disease, GERD. It's abbreviated as GERD, gastroesophageal reflux disease. Then how we treat this condition and what are some complications associated with GERD. Then in the fourth section, we will talk about some miscellaneous motility disorders of the esophagus, which will be nutcracker esophagus, scleroderma, and also Schatzi's ring. These all can cause motility disorder. Then in the fifth and final section, then we will talk about the neoplasm of the esophagus, which are the leiomyoma, polyps, lipoma, fibroma, and haemangiomas. And also we will talk about the carcinoma of the esophagus. So all that will be discussed in today's lecture topic, which is esophageal motility disorders and neoplasm of the esophagus. So keep watching sqadia.com.